Most people with varicose veins go through exactly the same sequence. Spider veins appear, they get ignored. The veins become more visible, you buy a cream. The bulges start, you finally see a specialist, get a referral for surgery, the surgery happens. 2 years later, the veins are back. That's not bad luck. That's what happens when you treat what you can see and leave the cause completely untouched. Here's what almost nobody says. Varicose veins are not a skin problem. They're not even primarily a vein problem. They are a system failure, a breakdown in the mechanics of how blood actually flows through the legs. And this failure has concrete, treatable causes. Anyone who understands these causes can actually do something about it. So let's go back to the beginning. What exactly is a varicose vein? A varicose vein is a vein that has stretched and lost its shape. Inside every vein there are tiny valves, small flaps of tissue that work like one-way gates. They let blood flow upward toward the heart and snap shut so the blood can't slide back down. When a valve weakens, blood pools behind it. Pressure builds up inside the vessel. The wall bulges outward. That twisted, visible vein under the skin is a valve that has stopped doing its job. Now picture the physical task your leg veins have to fight through every single day. The heart pumps blood downward through the arteries. That part is easy, gravity helps. But getting the blood from your feet back up to your heart is, in the average adult, a climb of about 1.20 to 1.40 meters. The heart plays no direct role in this return trip. The job is handled by two systems, those valves and the leg muscles. Every time the calf muscle contracts, it squeezes the vein like a pump and pushes blood upward. The valve closes so it doesn't fall back. The muscle relaxes, the vein refills from below. The next contraction sends it further up. That's how the blood finds its way home. If either system fails, valves or muscles, stasis develops. The blood stands still, pressure rises, walls stretch. So what breaks the valves? There are three main mechanisms, and most people have never heard of the first one. The first cause is pressure from above. The organs in the lower abdomen, the intestines, the uterus, the bladder, sit directly above the large veins that drain the legs. When these organs are heavy, displaced, or have sagged downward, they press on the large pelvic veins beneath them. This compression creates a partial blockage. Blood trying to rise up out of the legs hits resistance at the top and backs up. Pressure throughout the entire leg venous system rises. Pregnancy does this. Chronic straining on the toilet does this. Repeatedly lifting heavy loads does this. Anything that pushes the abdominal organs downward increases the burden your leg veins are already carrying. The second cause is a structurally weak vein wall. Vein walls are made of collagen and elastin fibers, the same proteins that give skin its elasticity. In some people, these fibers are thinner than average from the start. It's called connective tissue dysplasia, an inherited tendency for connective tissue to be more fragile than normal. People with this pattern often notice unusually flexible joints, a history of easy sprains, and varicose veins that appeared early and spread quickly. On top of genetics, a vitamin D deficiency weakens the vein wall because vitamin D is essential for collagen formation. A lack of bioflavonoids, plant compounds that strengthen the vessel wall and reduce its permeability, accelerates the breakdown further, and chronic low-grade inflammation in the surrounding tissue, often driven by diet, slowly undermines the structural integrity of the wall over time. The third cause is thick blood. Blood viscosity, how thick or thin the blood is, directly influences how hard the veins have to work. Thick blood moves slowly, builds pressure, and strains the walls. The biggest driver of blood viscosity in otherwise healthy people is dehydration. Not severe dehydration, but a chronic mild undersupply of fluid that most people walk around with every day without realizing it. Now let's get to the 5-step plan. Each of these steps targets a specific part of the problem. Together, they work as a system. Step 1. Improve the flow properties of the blood. The medical term is hemorrheology, the science of how blood flows. Better hemorrheology means less pressure on the vessel walls and a lower risk of clot formation. The starting point is water. For someone with varicose veins, the minimum is 30 milliliters of water per kilogram of body weight per day. At 68 kilograms, that's roughly 2 liters. At 80 kilograms, around 2.4 liters. And that means water. No coffee, no tea, no juice, no soup. Water. Coffee and tea don't count because caffeine acts as a diuretic. It makes the kidneys excrete more fluid than you took in. The drink goes in, but the body ends up with less water than before. That doesn't mean you have to give up coffee. It means every cup is a reason to add one more glass of water to your day. 2 natural substances are worth adding here because they both improve blood circulation and act as venotonics, compounds that help the vein walls contract and hold their shape. The first is turmeric. Turmeric contains curcumin, which reduces inflammation in the vessel wall, inhibits platelet aggregation, making platelets less prone to clumping and forming clots, and improves circulation in the smallest vessels. This isn't folk medicine, this is pharmacological research. Half a teaspoon of turmeric added to a warm meal every day is a meaningful therapeutic amount. The second is ginger. Ginger contains active compounds called gingerols and shogails. They reduce blood viscosity, improve flow in the microcirculation, and have a direct anti-inflammatory effect on the vessel walls. An approach documented in clinical practice that shows real results. Slice fresh ginger root, pour boiling water over it, add a slice of lemon, pour it into a thermos, and sip on it evenly throughout the day. The key word is distributed, not all at once. This keeps the concentration of the active compounds in the blood steady instead of letting them spike and then fall. Step 2. Reduce tissue swelling in the legs. This step is less obvious, but it's enormously important. When the tissue around the veins is waterlogged and swollen, it compresses the vein from the outside. Blood has a harder time flowing through a compressed tube. The vein works worse, the swelling gets worse, the swelling puts more pressure on the vein. It becomes a self-reinforcing cycle. The worse the swelling, the more the vein suffers. Where does the tissue swelling come from? Primarily from food. There are 3 categories of foods that cause fluid retention in the tissues. Cutting them back makes a real difference. The first is sugar. When you eat sugar, the body stores part of it as glycogen, a storage form of glucose in the muscles and the liver. 1 gram of glycogen binds about 3 grams of water. The more sugar you eat, the more water your tissues hold on to. This isn't theory, it's immediate biochemistry. Sugar also triggers chronic inflammation in the vessel wall, which speeds up its deterioration. The hidden sources most people overlook: packaged fruit juices, fruit yogurts, bottled sauces, industrially produced bread. A carton of carrot juice from the supermarket shelf typically contains as much sugar as a can of soda. Read the labels. The second is monosodium glutamate and similar flavor enhancers. They disrupt the sodium-water balance at the cellular level. Cells hold on to more sodium, and sodium pulls water with it. The result is a chronic low-grade fluid retention throughout the entire tissue. Where do you find it? Chips, crackers, fast food, frozen ready meals, packaged soups, instant broth. Essentially most of the middle aisles of the supermarket. The third is dairy. In a significant portion of people, casein, the main protein in cow's milk, triggers a chronic low-grade inflammation in the gut. This inflammation contributes to fluid retention throughout the entire body. This doesn't apply to everyone equally, but if swollen legs are a stubborn problem, it's worth cutting out dairy for 3 to 4 weeks and seeing what happens. The body gives a clear answer. What to add instead? Foods that support kidney function and help the body excrete excess fluid. Cranberries and lingonberries are natural diuretics. Blend them with water, no added sugar. Horsetail, corn silk, parsley, celery. These can be brewed as tea or found as ready-made herbal blends in most health food stores. And seasonally, cucumber, watermelon, honeydew melon, 80 to 90% water with a mild diuretic effect. None of this is complicated or expensive. It just has to be consistent. Step 3. Activate the muscle pump. This is perhaps the most important step in the entire plan and the one most often skipped. As mentioned earlier, the leg muscles are the engine that drives venous return. Every calf contraction is a pump stroke. If the pump isn't working, the blood doesn't move. That's why varicose veins are especially common in people who stand or sit in one position for hours. Surgeons, hairdressers, salespeople, office workers. 8 to 10 hours with the leg unmoving means 8 to 10 hours with the venous pump essentially switched off. Blood stands still, pressure builds, walls stretch. There's a stubborn myth that needs to be addressed head-on that people with varicose veins should spare their legs and avoid exertion. This is not just wrong, it's harmful. Controlled physical activity is not a risk for someone with varicose veins. It's part of the treatment. The exercises to limit are heavy weight training with breath holding and long, hard running on asphalt. Rhythmic leg movements that repeatedly contract and relax the leg muscles. That's medicine. Here's a 3-exercise sequence documented in rehabilitation practice, designed to activate the venous pump from top to bottom. Exercise 1. Sumo squats for the pelvic floor and the inner thighs. Stand with your feet wide apart, toes turned outward. Lower yourself down as far as your anatomy comfortably allows. Stand back up. 10 reps. The wide stance engages the inner thighs and the glutes, which control venous drainage at the pelvic level, the upper part of the venous highway back to the heart. Exercise 2. Standard squats for the thighs. Feet shoulder width apart, toes forward. Lower yourself to roughly parallel and stand back up. 10 reps. Pay close attention to breathing. Inhale on the way down, exhale on the way up. Holding your breath during a squat sharply increases pressure inside the abdomen and creates exactly the downward force on the pelvic veins that makes varicose veins worse. Exercise 3. Calf raises for the strongest pump in the leg. Stand upright, slowly lift onto your toes, hold at the top for a second. Lower yourself slowly. Continue until you feel a mild burn in the calves. That burn tells you the muscle has been thoroughly engaged and the pump has kicked in. That's the venous pump in direct action. The entire sequence takes 3 to 5 minutes. Do it at least 3 times a day. If you work at a desk, get up every hour, and at minimum, do the calf raises right at your workstation. Take the stairs instead of the elevator. That counts. Walking is generally one of the most effective things you can do for your veins. 30 to 40 minutes of walking a day brings a measurable improvement in symptoms within 2 to 3 weeks. Step 4. Clear the mechanical obstructions. This is the part of the plan almost nobody talks about, and often the reason venous problems keep progressing, even when someone is doing everything else right. Here's the anatomy. The superficial veins in the legs drain into the deep veins. The deep veins of the lower leg travel upward, pass through the back of the knee, become the femoral vein in the thigh, pass through the groin, and become the pelvic veins in the pelvis. The 2 pelvic veins merge into the inferior vena cava, the largest vein in the body. This vein runs alongside the abdominal aorta, passes by loops of intestine, goes behind the liver, pierces the diaphragm through its own opening, and empties into the right side of the heart. That's a long journey. And along this journey, there are at least 5 anatomical points where external pressure can partially block the vein. If even one of these points is obstructed, pressure builds up throughout the entire area below it. No amount of exercise or fluid will lift a blockage that sits higher up. Point 1. The groin and pelvic region. The femoral vein runs through a narrow anatomical canal. Right next to it, on the right side, sits the cecum, the beginning of the large intestine. On the left side, the sigmoid colon. If there are adhesions, chronic inflammation, or a chronically bloated gas-filled intestine, the vein gets compressed. Blood can't drain properly out of the leg. Point 2. The small intestine. The loops of the small intestine take up most of the abdominal cavity. If the small intestine is distended, cramping, or has sagged below its normal position, it exerts pressure on the pelvic vessels. Chronic constipation, irritable bowel syndrome, persistent bloating. These aren't just digestive complaints. They are structural forces acting directly on the vascular architecture of the legs. Point 3. The liver. The inferior vena cava runs directly through the liver tissue. An enlarged, congested, or fatty liver displaces the vena cava and creates a partial resistance to blood flow. Fatty liver isn't just a story about liver enzymes and metabolic risk. It's also a compressive factor in venous circulation. Point 4. The diaphragm. The diaphragm is the dome-shaped muscle that separates the chest cavity from the abdominal cavity. The inferior vena cava passes through its own opening in the diaphragm. When the diaphragm moves freely with every breath, that rhythmic movement actually supports venous return. It creates a gentle suction effect that pulls blood upward. When the diaphragm is chronically tight, which happens with sustained stress, poor posture, and a sedentary lifestyle, this opening narrows and venous return is impaired. What do you do about these obstructions? You work on them directly. The technique is called visceral massage, a manual mobilization of the abdominal organs, performed either by a trained therapist or, with the right guidance, by the person themselves. Gentle pressure over the cecum in the lower right and the sigmoid colon in the lower left can loosen adhesions and relieve tension around the vein. A slow, circular clockwise massage across the middle of the abdomen improves intestinal motility and reduces pressure on the pelvic vessels. Gentle, sustained pressure directly under the rib cage during a full exhale works on diaphragm tension and restores its freedom of movement. These changes build up slowly. Adhesions that took years to form don't dissolve in a week, but they respond to consistent, patient daily attention. And once the mechanical obstructions start to clear, everything else in this protocol becomes noticeably more effective. Step 5. Strengthen the vein wall itself. While you're addressing the mechanical factors, you also have to give the vessel walls the building blocks they need to stay resilient. That means correcting 2 common deficiencies. The first is vitamin D. Vitamin D is essential for collagen synthesis, the production of the structural protein that makes vessel walls strong and elastic. When vitamin D is low, blood vessel walls become less flexible and more prone to damage. The majority of adults in northern latitudes have chronically low vitamin D levels, especially from October through April. A blood test for 25OH vitamin D gives you the number. The optimal range is 50 to 100 nanomoles per liter. If you're below that threshold, it's worth discussing with your physician because correction under medical supervision matters here. The second is bioflavonoids. Bioflavonoids are plant compounds that directly strengthen the vein wall, reduce its permeability, helping it maintain its structure and stop leaking fluid, and reduce inflammation throughout the vascular tissue. Natural sources include blueberries, black currants, sour cherries, aronia berries, citrus fruits, and buckwheat. This is not a side issue. The two most widely used pharmaceutical vein medications, diosmin and hesperidin, are derived directly from bioflavonoids. When you get these compounds from whole foods, absorption is better than from supplements alone. A quick word on compression stockings, because the question comes up constantly. Compression stockings, the knee-high type, lower the pressure in the superficial veins, reduce swelling, and relieve discomfort. That's genuinely useful, but the moment you take them off, the veins are back under full load. Compression doesn't address a single one of the underlying mechanisms that cause the varicose veins in the first place. Use them as support, especially on long flights or during extended periods of standing, but not as a substitute for actually addressing the cause. On the topic of surgery, laser ablation, sclerotherapy, phlebectomy, these procedures work. They effectively remove the damaged vein. The cosmetic result is real, but if the cause hasn't been addressed, new veins will form next to the treated area. This is a pattern that shows up in patient records again and again. A patient has a successful procedure. A year and a half to 2 years later, they're back with 9 new varicose veins on the same leg. The surgical result was technically correct. The underlying system was not corrected. Surgery is a legitimate and sometimes necessary tool. It's the last step, not the first. If you come to surgery after implementing everything else in this protocol, the odds are good that a procedure will hold for years instead of months. Now, about blood clots, because this fear sits in the minds of many people, and it's partly justified, partly not. A clot that forms inside a superficial varicose vein is called thrombophlebitis, inflammation of the vein wall with a clot inside. The signs are unmistakable. The vein becomes hard and cord-like. It hurts on pressure. The skin over it turns red and feels warm. If you notice these signs, see a physician the same day and get a duplex ultrasound of the veins. The duplex ultrasound is a specialized vascular ultrasound that shows not only the anatomy of the vein, but the actual speed and direction of the blood flow inside it. Based on that result, a doctor can decide whether anticoagulants are needed. Here's the important distinction. A pulmonary embolism, a clot that travels to the lungs, is a complication of deep vein thrombosis, not superficial vein thrombosis. Varicose veins are superficial veins. They are anatomically separate from the deep venous system that connects to the lungs. A clot in a varicose vein in the calf very rarely leads to a fatal embolic event. That's why deep vein thrombosis deserves serious vigilance, especially after surgery, prolonged immobility, or flights over 8 hours. Varicose veins carry some increased risk, but it's considerably lower than the scenarios many people picture. Don't ignore warning signs, but don't inflate the fear beyond what physiology actually justifies either. One important age-related factor to keep in mind. From 50 onward, the rate at which varicose veins progress accelerates. This happens for 2 reasons. In women, estrogen levels fall, and estrogen plays a direct role in maintaining the elasticity of blood vessel walls. In both men and women, muscle mass steadily decreases from midlife onward. Less muscle means a weaker venous pump, which means more stagnant blood in the veins. The clock doesn't stop, but it can be significantly slowed with the right daily habits. How old are you? Leave your age in the comments. It influences which specific recommendations are most relevant to the point you're at right now, and it helps shape future videos around the audience that's actually here. So here's the whole plan, clearly laid out. Water, 30 milliliters per kilogram of body weight per day, every day. Add turmeric to warm meals and sip ginger tea throughout the day. These are daily habits, not occasional add-ons. Food. Cut back on sugar, avoid MSG and packaged ultra-processed foods. Try a dairy-free phase if swollen legs are a stubborn problem. Add cranberries, lingonberries, horsetail, parsley, celery, and fresh seasonal produce to support natural fluid excretion. Movement. 3 times daily, sumo squats, standard squats, calf raises to the burn. Stand up every hour and move. Walk 30 to 40 minutes daily. Take every set of stairs available to you. Abdominal work. If the veins are still progressing despite all of the above, examine the mechanical obstructions. Work on the groin, intestines, and diaphragm through visceral massage, either with a therapist or with proper guidance. This is slow work. Do it every day. Nutritional foundation. Get your vitamin D tested. If it's low, work with your doctor to correct it. Eat bioflavonoid-rich foods consistently. Blueberries, sour cherries, citrus, buckwheat. Emergency signal. Pain, hardening, and redness along a vein means see a physician the same day and get a vascular ultrasound. Varicose veins are not a condition you simply have to accept as permanent. They have causes. Those causes are treatable. The process can be slowed and in earlier stages actually reversed, but only if you work on the system that produced it, not just on the vein itself. As you can see, everything here is for your information and education. Your health picture is individual, and the most useful conversation you can have is with a clinician who knows your full history.